So I see you have highlighted a little bit of the misconceptions. Okay, but I'm sure there are more. So what other misconceptions do people have about Clubfoot?
Well, I know apart from the the one of witchcraft, and some people think
That's
it
normal. We
that's
think
normal.
we think everything is witchcraft.
Yes. So another thing, some people think is something that the mother took during pregnancy. You know, some women take traditional mixtures like
Yeah.
abo and so many things. And then some people I've heard one woman said, that she preferred to be sleeping on the left side of her bed of her body throughout pregnancy. That do I know whether that was what caused it? Maybe because the baby is always used to sleeping on one
One
side.
side.
I said not at all. Once you move your body, your baby always moves with you.
Yeah.
And your baby has enough room anyway, in most cases, to move around. And then I've also heard some people, well, do you know the funny thing is that we've not really researched many of these things. Some people feel it's the size of the baby.
Okay.
Some people might give birth to a big baby and feel that maybe the womb was not spacious enough for the big baby. So there's a myriad of myths,
Yeah.
but these are not true. Until we find the true cause, everything is speculations and risk factors.
Yeah. Wow. So, what are some of the limitations and challenges that of providing Clubfoot treatments in Africa?
Africa, yeah. Thank you. There's a lot. There's a lot of challenges. Yes,
I suppose so.
yes,
we
I'll
have
just
a
highlight.
lot of challenges. Yes.
I know. I'll just highlight a few.
Mm.
Recently I was working on a grant that a donor was supposed to provide a vehicle grant. Let me use it as an example. So they asked some of the questions to just ask. I didn't know where to start from. we, we want to talk about, I want to start with the political instability. You know, in many countries, if you look around, I'm not just talking about Nigeria, but most of my examples will be from Nigeria.
Yeah.
Many African countries are going through political instability. A government will start, maybe they will even start good initiatives that favor health, a lot of health programs, and then another government will come and scrap it, and they'll come up with their own as well. So there's no continuity.
Yeah.
Because some of these health intervention programs, you have to run it for some years, in some cases for some decades. See what we are doing with HIV program. You have to run for some decades before you start talking about health outcomes, before you start talking about evaluation programs to see where we are coming from versus where we are going. So political instability is a big problem about establishing political will.
Yeah.
And then, of course, when you have unrest, when you have all this insurgency, when you have social unrest, injustices everywhere, people relocating. We've had cases of our patients relocating from one city to the other without informing anybody.
Yeah.
You don't know whether they died. You don't know whether they left the country. You don't, because assuming they told us and we know the state. Let's just take Nigeria for example.
Yeah.
If a patient is moving from one state to the other, we would like to know. We'll probably like to link him or her
to the available
another clinic in the exactly, but they will not just tell you. Some of them left unplanned, in distress, and then there's also this migration. What do they call in-country migration? Some of these things they confuse statistical data. Imagine if you have a data on Nigeria and you have it state by state. Let's even take Clubfoot, for example. You have a population data and you know that in Lagos, let's say 50,000 babies have Clubfoot in Lagos and Ogun State, in Kwara State. Before you know it, cross migration, people living for different reasons, mass movements, this data gets mixed up and messes up and gets messed up. You won't be able to provide concrete interventions that will speak to the particular population. So these are some of the challenges. And then we also want to talk about the fact that government has not really paid attention to many of these things. So apart from HIV malaria, even the HIV programs. If you look well, it's mainly international agencies that are funding it.
Yeah.
The PEPFAR, the Global Fund, you said, you know, there's this counterpart funding that government is supposed to provide for every so and so hundred of thousands, for every so and so million of dollars we receive. Government is supposed to bring their own. Many times, government has not been able to fulfill that. You
Yeah.
know, sometimes it's as bad as when you go to the community like primary health care. Once they hear an NGO is coming with an intervention, they're even happy. They're not even, we're no more even ashamed of ourselves that this international aid, it has really lingered. Can't we look for culturally suitable solutions to our own problems? So, and even if an international agency wants to help, they still depend on you to give them context. So you still have to own the program. So those are some of the challenges. Or are we talking about education? The general literacy level in Africa is low. I think one publication, there's a study I saw. What was this website? I think it's Statistica. There's a study I saw. They did a study in 2021, but they published it just last year. The average literacy level in Africa is 67%,
Yeah.
but it's higher in Southern Africa and lowest in West Africa. West
Yeah.
Africa literacy level is 54%. And then when you want to break it down, even though there are some high rising ones, like high performing ones like Seychelles and Equatorial Guinea, they're in the 95%. Someone like Nigeria, in Nigeria are only 77%. I even think it's lower.
I
I'm
believe
even
it's lower. I believe
I
it's lower.
believe it's lower. I'm telling you. Sierra Leone, Liberia, 48%. Cote d'Ivoire, 43%. Chad, 40%. It keeps coming down. Then
Yeah.
Niger is 19%. What this means is that people are not even able to read and write, and information sharing and innovation is impeded. Imagine seeing a signpost.
Yeah. And you can't read it.
Imagine,
You
and
don't
you
know
can't
what it
read it.
says. Yeah.
Do you understand? I remember once my sister's domestic help couldn't read until she stayed with her for like 5 6 years and she could read and write. I remember
Good.
one particular
That's good.
scenario that the child was sick and you want your domestic staff to give a child medication or to do something just by going to the medicine or cough syrup to read.
Yeah.
Okay, spell, the person cannot do. So this, it might seem little, but these things affect the general population when you start talking about overall literacy level. That means
Yeah.
we cannot move
See,
beyond a
literacy
certain.
level affects public health issues very much.
Yes,
Please
yes.
raise your image. Yeah. Yeah.
Oh, okay.
Okay. Very good again. Yeah. Yeah. So yeah, literacy is a big challenge, and
Yeah.
it
So I also
affects
want to
everything.
talk about, yeah. So in addition to that is you might say climate change. I wanted to add climate change before I talk about poverty. Climate change is a big deal. I want to talk about the recent flooding that happened in Nigeria. At the same time, in fact, my colleagues, my partners in Liberia and Sierra Leone, during rainy season, I've noticed that the work drops.
Mm.
Clinic staff cannot access clinic, normal work.
Wow.
The patients that you're giving free treatments are not even able to go to clinic because the floods are heavy.
Oh my God.
And you remember what happened in Nigeria last year and even 2 years
Yeah.
ago.
Yeah.
Cars were stuck at
Yeah.
that Lokoja bridge. So it's a big deal. So climate change and the fact that our government has not been able to put measures in place. I keep asking myself, every year we are talking about Lokoja flooding. Why can't we do something to reinforce the is it the dam or the river or the bridges or something? So it's a big issue. And then poverty is at the middle. All these things I've mentioned, poverty is at the middle, is at the center of it all. You know, people want to eat first
Yeah.
before going to school. People want to eat first before going to hospital. Do you know, although that we are offering, our partners are offering free treatment of Clubfoot, do you know many people cannot afford transport fare to go and access it? We still give transport subsidy to people that live far for them to be able to come to the hospital. Then a mother will tell you, oh, I have 5 children, oh, who will take care of the other 4 when I come? And then sometimes when they come to the hospital, they spend the whole day. So you're
Yeah.
talking about the economic implication of accessing care. You brought a child to hospital, but who will take care of the other 4? Who will take care of your shop in the market? So
Yeah.
we are still dealing with issues and consequences of poverty. you
Yeah.
know, in sub-Saharan Africa, or even Africa as a whole. So these are the
Yeah.
salient issues I know
Yeah.
that affect. We're not, and then poor infrastructure. You know what is happening with our hospitals? We
Yeah.
don't have enough. That's number one. The ones we have are not well equipped. You know, so there's no road, there's no accessibility. There are no roads. There are no electricity in medical school. Then sometimes you'll be studying. Sometimes you'll be in theater. They will take light. It will
Yeah.
take some time before they do the changeover. I
Man.
heard that in some community hospitals, they use lamp and torchlight in the theater. Do you
Oh my
understand?
God.
So, or water supply. Many times you go to
You
hospitals,
see,
primary healthcare
you
centers,
see,
there's no water. It's
the
terrible.
the social issues
Hmm.
affecting our countries are
Yeah,
enormous. You see,
it's a lot.
and uh, see, I've seen some videos. Uh, I can't talk to you about them, even though they are medical, but they are not in your area of specialties. So I don't think you have the
Yeah.
information to give me. So I'm looking for people who are policy people, okay, and
I
connected.
know what you're talking about, but
Yes,
let's not go there. I
yes,
know one of
connected
the videos
to
you're saying.
people in power.
Yes,
Yeah.
yes,
So
absolutely.
wow. Anyway, how does Clubfoot affect women and children in particular in families? Because
Okay.
I know something like this that needs a lot of managing, in
Yeah,
particular by mothers, will
yeah,
affect nearly
yeah,
everything else in the house.
yeah. So let me start by the condition itself. It affects both women, both females and males. So the
Mm,
male child and the female child, but the males are more prone to it. Study has shown that baby boys are more
yeah.
likely to be born with Clubfoot. And but that aside, because in Liberia,
Okay.
I saw a mother that brought her daughter to clinic and she herself had Clubfoot on both feet. So females are
Really?
also affected. Now, yes. Now to the question of how it affects, like I already started answering it. It affects the woman so much. Sometimes there's this unseen, unwritten burden of care that is on us women. We are the ones responsible for the health and well-being
Yeah.
of the
See, I
child.
see.
It's just in a
I know.
few.
Because I can remember when I was a young child. Okay, my mother was always the one taking us to clinics. I
Yeah,
mean, hey,
they're the
my
ones that
dad did a lot of things, but when it comes to
yeah,
our health as children, it was
yeah,
always my
immunization,
mom. Yeah,
check-up, immunization. They'll keep the immunization card, birth certificates, and all that.
yeah.
It's interesting. It's just in few families that you see the men supporting.
Mm,
They may not be at the forefront, but a
yeah,
little help goes a long way. So it affects the woman even emotionally, mentally, economically. Like I told you, a woman is the one likely to forfeit her business, her day's business, to be able to accompany the child to the hospital. Sometimes it takes the whole day. So
yeah,
imagine that she's the same person that will rush back to make food whenever the clinic finishes. She's the same person that will rush back to make food for the kids she left behind, and probably for the husband that will come back later in the day, you know. And imagine with all these difficulties, she's also the same person that still has to ask for permission to go to the hospital. In many families in the north, before a woman even takes the baby to go and access the free care, she still has to ask for permission. You cannot just carry your child and go and see a medical doctor. So these things affect her entire being, her psyche, her emotions, even her progress in her career. You
yeah,
see some petty traders, you see some business women, they are not able to go far because they are distracted with issues like this. So that's how I know it affects women. It affects women a lot,
yeah,
and we keep working hard to. That's what I was saying. We have some parental engagement sessions where we keep encouraging the women, encouraging the men, the parents. We even tell the women, next appointment, we try to merge it with something. Next appointment, come with your husband. Let's address you together. sometimes when they submit their details, their phone details, we ask for the man's number so that as we are sending SMS reminder to the woman, we're also
send
sending
one to him
SMS
too.
reminder to him too, so that by the time he keeps seeing it pop up, he'll be like, what's this? Can you tell me a bit about this? So that he's not completely aloof.
Yeah.
So
that's a good strategy. Yes.
Yeah. So that's it in a nutshell. Yeah.
Wow.